You're listening to the Connected Health Podcast, where we bring together the science of functional health, the strategy of sustainable habits, and the wisdom of your body to help you feel vibrant, strong, and empowered. I'm your host, Vanessa Cohn. I'm an integrative health practitioner, nutrition coach, and personal trainer, and I own Connected Habits Coaching to help women heal from the inside out using personalized strategies that are rooted in hormone health, metabolism, nervous system support, and root cause healing. If you've ever felt like learning to be healthy is so overwhelming, this show will help you to discover those healthy habits so that you can reconnect with your body and reclaim your health. So today's topic is endometriosis because March is Endometriosis Awareness Month. This condition is very common, complex, and often misunderstood. In fact, so much so that on average, it takes women 7 to 10 years to get that diagnosis if they ever get diagnosed at all. And sometimes women's pain is dismissed as normal. And today we're going to be breaking it down from a holistic and integrative perspective. And it's likely that you might know someone with some of these symptoms, or you might know someone with endometriosis, whether or not they have been diagnosed. Maybe they're on their journey or on their way, or maybe they already have been diagnosed with this condition. So endometrial tissue is the tissue on the inner lining of a woman's uterus. This is the lining that is shed during a menstrual cycle and during the phases of the menstrual cycle. Endometriosis is a condition, a disease where that type of tissue starts to grow outside of the uterus. So normally, healthy tissue is grown within the uterus. It's shed every single month. When it's a condition like endometriosis, that tissue grows outside of the uterus and starts causing problems there. It can grow in the ovaries, it can grow in the fallopian tubes, the pelvic lining, even the intestines, and the bladder. So the problem is, it is inner uterine tissue and it behaves like that. It thickens, it breaks down, and it bleeds. And so women with this condition will often find that they're in excruciating pain. There's always inflammation. Periods are not normal, and they'll often have issues with fertility as well. So when this uterine tissue starts to break down as it would normally in the uterus, where it thickens, breaks down, and bleeds, it doesn't have anywhere to go or get shed out of. So that causes inflammation. It causes pain. Now let's look at the specific symptoms of endometriosis. Common symptoms will look like severe menstrual cramps, pelvic pain that is chronic, not just throughout the period, pain with sex, bowel movements, urination, heavy periods or irregular periods, and infertility. Now, the less common symptoms that you'll see is bloating, and there's a term called endobelly. Bloating can come for many reasons, but if you're having bloating from endometriosis, it can also come with other symptoms as well. Fatigue, nausea, low back pain, and digestive issues similar to IBS. And that's another thing that I want to note. Maybe some women out there are not diagnosed correctly with endometriosis, and maybe they're told that, oh, you have IBS. If that's your situation and your doctor's treating you for IBS, but not actually treating what the root cause is, which is endometriosis, you may be stuck in a situation where you're not getting better. And I want you to also understand this point. The severity of your symptoms is not the same as the severity of your disease. You could have really bad progression and milder symptoms for a time, or it could even be vice versa. Everyone's experience of endometriosis is a little bit different. Let me give you some important statistics of this disease. It affects 1 in 10 women globally. And I would say that's even undershooting just because people take so long to get diagnosed and to get treated. Endometriosis is the leading cause of infertility. And like I mentioned before, that diagnosis is delayed 7 to 10 years. And some women just give up and start to accept their normal. And they cover up the pain with painkillers and hormonal birth control, when the body is screaming to be seen and heard and noticed and taken care of. So why is there such a delay of the diagnosis? Number one, the painful symptoms that women have that accompany their periods are dismissed as normal. It's normal to have cramps. It's normal to have headaches, or it's normal to have irregular periods. And it's not. It's not normal. Another reason is the misdiagnosis of IBS and or anxiety. Another reason is imaging that is done when doctors will start to look down at the uterus area will miss lesions because the imaging most likely will look for larger masses of tissue. And the truth is endometriosis can start at the cellular level, very small, before it grows into something bigger. And then another reason that it takes so long to diagnose is the diagnosis typically in Western medicine requires surgery to get that diagnosis. They'll go down in with a scope to see what's going on. And that's usually when they do it. And many people don't get to the surgery point because it's a little bit more invasive of a method. So to all the women suffering from endometriosis or suspect that they do, I want you to have a glimmer of hope because it is unfortunate that it does take so long to get diagnosed, but I don't want you to dismiss your symptoms as normal because there's not, and there is help. There's hope. Endometriosis is one of those complex conditions in the reasons that we have discussed previously, but some women don't find out that they have it until they're at the point where they want to start a family and they're having issues with infertility. They go through all the tests and the imaging, and that's when they discover that they have it. It can be loud or it can be silent. And it's not just a reproductive condition, although the discovery comes up often when reproduction is the goal, but it is related to so many systems of the body. Endometriosis happens as a result of inflammation. It's related to the immune system. It's related to hormones. It's related to metabolism. It's related to the gut. All of these things play a role within endometriosis itself. That's one of the reasons that it is so complex. Let me give you a list of contributing factors that could be causing it. There's often not one root cause. There are several things coming together to create the perfect storm, which leads to disease. This is why I drill down lifestyle factors and nutrition so much, because the way that you treat your body on a daily basis, your habits are the foundation of how your body will treat you in return. Things that you don't think about exposing yourself to every single day will have an effect on your health as it grows and builds. So here's that list of contributing factors. Estrogen dominance. This is a condition where your hormones are imbalanced in such a way that estrogen is almost dominating. That doesn't necessarily mean that estrogen is high, but estrogen might be higher in relation to the role that progesterone is playing, or even testosterone. Hormones are so imbalanced that it causes estrogen to act in a larger way than is normal. Another contributing factor is chronic inflammation. Inflammation can come from anywhere in the body, injuries, infections relating to the gut, and I'll let that lead into the next contributing factor is gut dysfunction. If your gut is inflamed, the lining of your gut is inflamed, you're going to have a ton of issues, including autoimmunity, leaky gut symptoms, whole body inflammation, overgrowth of bacteria, pathogens, parasites, viruses, all of these things. If your gut function is low, you're not going to be digesting food. You're not going to be absorbing nutrients. Your immune system is going to be dysregulated. Your hormones are going to be imbalanced, and your mood and mental health will be affected as well. The next contributing factor also ties in immune dysfunction. 70+% of your immune system resides in your gut, in your digestive system. And if that is inflamed and your gut is out of whack, you're also going to have lower immune function in general. We've also got contributing factors like toxin exposure. I've had several episodes about that. I don't think that we are unaware of how many toxins exist in the world around us, but women specifically are targeted in the beauty industry, where advertisements for all sorts of makeup, perfume, and products, if you have this, you're going to be beautiful. If you use these hair products or these skincare products, it'll solve all of your problems. And truth be told, those ingredient labels on those products are longer than my arm. And those things accumulate in your body, in your cells. There are some things that your body absolutely cannot break down. And those are called POPs, persistent organic pollutants, that stay in the environment, stay in your body forever because they can't break down. Other contributing factors include stress and nervous system dysregulation, trauma. All of these things have an effect on the body, and it's hard to keep up. And then another contributing factor is nutrition related, and that's blood sugar balance, which I do talk a lot about on this podcast as well, because it is so important. It shouldn't surprise you that our body works in converging systems. Systems work together, and the things that affect those systems are the inputs, things like food, toxins, other things that you consume, whether it be visual, auditory, things can all affect the progress of disease in the body. The point is, there is no single cause of endometriosis, and there is no one-size-fits-all treatment. It's a conglomeration of factors that can contribute to it. And so don't expect there to be one pill to fix everything. Let's talk about how endometriosis develops. One of those factors that I mentioned just a bit ago is estrogen dominance. Estrogen dominance is actually quite common in modern women because of the lifestyles that we live, the food that we eat, the mindset of hustle and bustle, and all of those things together can create the perfect storm for estrogen dominance. And estrogen is a female hormone that promotes the growth of endometrial tissue. Estrogen is great in the right amounts, but too much of it can cause inflammation and it can cause lesions to happen and progress. Estrogen dominance is a cluster of symptoms that you'll see when your liver is not detoxifying well, you're having gut issues, you're chronically stressed, you have excess body fat, and your body is weighed down by environmental toxins, which are called xenoestrogens. They're toxins that promote estrogen in the body. And just a side note, one of the contributing factors of modern infertility for both men and women are environmental toxins that promote the overgrowth of estrogen in both men and women. And estrogen is one of the main female sex hormones. It is present in men, but it should be only present in very, very small amounts. And we're finding that men with fertility issues are having growing levels of estrogen. There's imbalances with estrogen and testosterone in men as well, causing issues with fertility. If you wanted to look at testing your estrogen or estrogen dominance levels, there are functional medicine tests that can test your estrogen, your progesterone, your ratio between the two, as well as your testosterone levels. And those numbers are helpful for a snapshot of your hormonal function. But I would also get tested your blood sugar levels as well. That's your insulin, your glucose, your A1C, and vitamin D levels. And there is a functional medicine test that I offer that has a snapshot of all of those as well. And we'll talk about that later. But that should be a good segue into blood sugar and insulin. These are some of the contributing factors to endometriosis that are often overlooked, but blood sugar dysregulation can lead to so many things, including more inflammation or more hormone imbalances and more estrogen dominance. Now, I've talked about blood sugar and insulin when it comes to hormone topics before. I've definitely brought it up in my first few episodes where we talked about female hormones, menopause, perimenopause. I've also talked about blood sugar balance in relation to weight loss, maintaining good energy levels, and so much more. Essentially, when your blood sugar is up and down on a roller coaster, you're going to have more inflammation. You're going to have more hormonal chaos as insulin is high and low again. What I want you to remember is if your blood sugar is unstable, your hormones will be unstable. If your hormones are unstable, you're going to experience downstream effects. I did mention earlier that endometriosis is largely an inflammatory condition. There's localized inflammation that can be the primary driver, but inflammation can also be full body. I would also recommend that you get some markers tested with your blood work, high sensitivity C-reactive protein, and then get your cytokines tested. Those are markers of inflammation within the body. If they're chronically elevated, we've got work to do. The role of the immune system is to take care of any pathogens and squash them. And in the event that that is going on, there will be inflammation as the germs versus the white blood cells are fighting. Inflammation is a part of that. But when we have immune dysfunction, the inflammation that comes from that doesn't get cleared out. When pathogens and toxins and whatnot are in the body, and they're not cleared out, they can recirculate, causing issues and causing more inflammation. If you want more visuals on that, I do have a gut health episode. Go check that out. Leading into gut health, which leads into the next topic, your gut impacts your estrogen metabolism, your inflammation, your immune regulation. Go back to that gut health episode that I did because you'll see what it looks like. And I recommend watching the video because you can see visually with illustrated images what it looks like to have gut dysbiosis, to have leaky gut, and just a visual image of what's going on in your body when you have gut dysfunction. Now, symptoms can come with endometriosis. And the main issue there is that your gut is in trouble. So if you work on your gut health, you can fix your hormones, you can fix your inflammation, you can absorb your nutrients better, you can help balance your blood sugar. Let's talk about how endometriosis is diagnosed. The gold standard is laparoscopy, where a camera is guided down into the uterus to look at the tissue as well as surgically remove it. MRIs are used as well on a limited basis, as well as ultrasounds. A majority of the time, the laparoscopy is an outpatient procedure, could take a couple hours. And the risks with that is, depending on your case of endometriosis, they'll try to get it all, or they might not get it all. You might have to have multiple surgeries to get out all of the tissue. There's also the condition where your tissue continues to grow back. In the functional world, we use hormone panels as well as symptoms to help diagnose that. I would do a combination of the two, especially with the functional testing, because you can actually see where levels are at. That can be your hormone and your gut levels, hormone levels, gut testing, and your levels of inflammation, so that you can have numbers to monitor to see how they change after the lesions are removed. The functional test can look like a hormone panel. Like I mentioned earlier, getting all your estrogens tested, progesterone. The Dutch test is very common, looking at those hormones and how they metabolize and their pathways. Inflammatory markers, like I mentioned, HSCRP, cytokines. And then another one I'll request that you add to your blood panels is homocysteine. If I would recommend gut testing as well. There's different types of stool tests like the GI map, but most stool tests will be looking at the different pathogens in your gut. Getting tested for nutrient deficiencies. And then if needed, if your case is really bad and the other type of testing doesn't seem to yield much information, there are total toxic load exams that you can do, like mold testing and heavy metal testing, if that's needed. Before I move into treatment, I do want to talk about the big question. Do I need a diagnosis to start making changes? No, absolutely not. If you want to have a diagnosis to be sure that you have endometriosis or insert condition here, that's fine. But oftentimes I see that people will label themselves by their diagnosis or use their diagnosis as an excuse for not to pursue life to their fullest or to make themselves small, to even play the victim. That's not to minimize these conditions that can be debilitating, but I do want to mention that you don't need a diagnosis to start making changes. If you get your regular blood work done and you suspect that you have endometriosis, but your blood sugar numbers are out of whack, you can actually start working on bringing those down. And I guarantee you it's going to help with your other symptoms that you're experiencing. You don't have to wait to be diagnosed to start making changes. You can start changing the way you eat. You can start clearing out the toxins from your personal care products and start switching them out for some things that are more natural. All of those things that you can start today, whether or not you have a diagnosed condition. Now getting on to treatment. So the conventional model will treat with a surgery like we did talk about, and that can be effective in removing the painful lesions. But if you still have the lifestyle and the hormone levels that bred those pieces of tissue in the first place, guess what? They're going to come back. There's also pain meds that they will put people on, hormonal suppression, and one of those methods is birth control or ways of shutting off hormones. Again, those don't treat the root cause. Birth control is considered a carcinogen. It doesn't allow the body to communicate naturally. Now, it's up to you if you want to use these other methods. Maybe you do it short term while you figure out what's going on in your body, but it is not something to solve the problem long term. It is a Band-Aid. It's not a solution. So I do recommend all of the testing that you can do that. None of these things are going to address your root causes. And women are tough. I've talked to some women with endometriosis and they're not on anything and they're just dealing with it. They're very tough, but I want you to know that you don't have to. On the other end, integrative and holistic methods include things that will not only help your endometriosis, but can help a lot of things. Number one, blood sugar balance. This looks like protein with every single meal. If you're visualizing a plate, the protein should be the star of the show. At least 25% of your meal should be a protein heavy food. Animal meats, eggs, fish. You can lower your refined carbs. So the more processed and sugary it is, the worse for your health it is for you. This will help you to stabilize insulin and your glucose levels within your body. Also want you to be mindful of eating fibrous food. So that's your fruits, your vegetables, your complex carbohydrates like rice and starches, potatoes, either white potatoes or sweet potatoes. Number 2, reduce your estrogen dominance. Get those estrogen and progesterone levels tested and see where they're at. Is estrogen dominating your hormone field? If so, you're going to want to support your liver because likely your liver's not clearing out that excess estrogen as it's supposed to do. You can do a type of liver detox. And simply put, you can do that with consuming more cruciferous vegetables in the brassica family. That looks like cauliflower, broccoli, Brussels sprouts, cabbage. Increase your fiber intake. That also supports your liver as well. Start cutting out toxins in your body. Maybe you're switching your makeup, your hair, your body wash, your laundry detergent for products that are more natural. People were cleaning their clothes and painting their eyelids since the dawn of time. So there are ways that are natural that come from the earth to start to switch things out. One of the things that I like to use is Castile soap. There are scented ones that you can get that are scented with essential oils like peppermint or lavender. There's also non-scented ones. And if you've got hormonal imbalances, I would avoid artificial fragrances in general because that can really help reduce inflammation and hormone imbalances. Castile soap has many uses. You can use it for dishes. You can use it to wash your hands. You can use it for laundry. You can use it as a shampoo. I use Castile soap almost everywhere. I use it for cleaning products. I have concentrated Castile liquid and I'll put it in a spray bottle and dilute it with water. And that'll be my disinfectant. I'll dilute it with water and I'll use that to wash my hands. I ran out of dog shampoo and I used it as a dog shampoo for my dog. It just has so many uses. It's amazing. I've used it in the laundry. Supporting your gut can also help reduce estrogen as well as your body's able to break it down and clear it appropriately. Another suggestion I'll make is nutrition. When it comes to the food that you eat, I mentioned high protein, but also switching to a primarily whole foods diet. This can actually solve so many of your problems, especially if you deal with inflammation and weight gain. Increase your consumption of omega-3s. Omega-3s are anti-inflammatory. They will help you to bring your inflammation down. The women that I coach, myself included, when we have hormonal or menstrual symptoms, consuming omega-3s often actually helps to bring down the pain because it's taking care of the inflammation, reduces cramps, reduces headaches, bloating, and sources of omega-3s can look like starting with whole foods first. Sardines, salmon, mackerel are my top 3. Personally, I'll eat salmon once or twice a week. And then on top of that, I'll supplement with an omega-3 supplement. And personally, when I'm on top of that habit of eating high omega-3 foods and taking the supplements, I don't deal with cramps or headaches when my cycle comes, which traditionally has been common for me. Reduce your intake of processed foods. If you have any food sensitivities, it would be important to figure out what those are. You can do that with elimination diet, with testing, which isn't my favorite method, or you can just take a food group out for a while and see what your body does in response to that. Do you drop a few pounds? Are you less inflamed? Do your joints stop hurting when you take out something like gluten or dairy? The most common food sensitivities are gluten, dairy, nuts, soy, eggs, and corn. So exploring where your food sensitivities might be causing you to feel worse. The next one is to heal your gut. This is important. I highly recommend working with a practitioner on this because you can do gut testing and see exactly what needs to be targeted. But many people, when they say, oh, I need to fix my gut health, they'll actually just start to take probiotics, and probiotics can help, but often you're not taking the right ones and it ends up being more of a problem. So definitely seek guidance when it comes to probiotics. You want to reduce your dysbiosis. If you do get gut testing and discover that you have overgrowth of pathogens that is affecting your digestion, causing bloating, causing inflammation, take care of that. Once those have been eliminated, inflammation levels will come down, digestion will start to look more normal for you. Next, work on your nervous system regulation. Stress exacerbates every condition under the sun. It drives inflammation, it hinders healing, and it causes hormonal imbalances, among other things. Things like walking, slowing down, breath work can all help. We move at such a fast pace, and this can look like eating really quickly so that you can move on to your next thing, zipping in and out of traffic to get to your destination. Whatever happened to doing things slowly and with intent and remembering to take a full breath in and a full breath out? Walking leisurely, all of these small habits that we can work on can actually bring our body's sense of stress down. Something else you can do, I mentioned supplements, and I'm an advocate for supplements if they're targeted. Don't take everything under the sun just because an influencer has told you that it helps. It might work for her because she's getting paid for it, but it might not work for you. Okay. Again, work with a practitioner, but some ones that I will mention that are generally helpful and effective for most people is magnesium. Do a blend of magnesium to help calm the body. And magnesium is a mineral that most of us are deficient in. Omega-3 is, like I mentioned, when you look at the label, you're going to see a bunch of long names, and the acronyms for the abbreviations for those are EPA and DHA. If you're dealing with inflammation, I would get something where the EPA number is twice as much as the DHA number. So there's your tip there when you're shopping. NAC stands for N-acetylcysteine. I love that supplement personally. I take it almost every day. It's good for respiratory health, inflammation, and your liver. And then something for anti-inflammatory purposes is curcumin. Curcumin and turmeric, you might have heard those interchangeably. I would not take that every single day for the rest of your life, but pairing that with ginger tea, ginger in your food, turmeric in your food can be a great amount of exposure. Over supplementing those things is something that I would not recommend. But if you take even some of these supplements in conjunction with balancing your blood sugar, nailing down your nutrition, helping your gut to heal, your symptoms are going to be so much better. And I want to remind you that supplements are supports to what you're already doing. That's why they're called supplements. They are supplemental. They're not cures. They're not fixes. They're not drugs. They're not Band-Aids. They're tools in the toolbox that we use to deal with our health problems. Now, if you're suffering from endometriosis, I want to give you some hope and empowerment to close this episode out. It is complex, but that doesn't mean that you're powerless. Whether or not you have been diagnosed and have had a surgery or multiple surgeries, remember that if the lifestyle conditions that were present when you developed endometriosis are still there, it's going to come back. Healing is in your hands. It looks like managing your inflammation, rebalancing your hormones, making sure that your gut is functioning okay, and supporting all of the body systems involved. It's complex, but with the right support, you can do it. To close out Endometriosis Awareness Month, I want you to remember that pain is not normal. You don't have to accept it. You deserve answers. And I want you to advocate for yourself until you get them. Add these extra markers to your blood work when you visit your doctor. Don't give up. If you have to find another provider that will listen to you, do that. And don't be afraid, even if it is not conventional, to explore root cause conditions with other types of testing, stool testing, blood work, hormone testing. All of this can help you out. Because these cluster of symptoms are really common and many women take forever to get diagnosed, I really want to ask you to share this with at least one person who's dealing with miserable symptoms and doesn't yet have answers. This could be something that opens their eyes to a potential avenue to pursue to see if they do have endometriosis. If you know someone with endometriosis and they're still stuck in spiraling, you could share this episode with them as well. I just want people to know that there is hope and there is support for them. Thank you for tuning into this episode of the Connected Health Podcast. You could follow me on Instagram and Facebook at Connected Habits Coaching and come join our free community, Connected Habits, a community for holistic and sustainable health. Remember, your body isn't broken, it's just asking to be heard. I'll see you next time.